Timor-Leste has made significant strides in improving healthcare since independence, but preventable diseases like tuberculosis continue to pose a major public health challenge. RTTL World News spoke with Clipper Domain Clinics Director Joaquim Freitas Soares about the progress of the country's health sector and the ongoing fight against TB.
Could you tell us about your organization's work in Timor-Leste?
Clipper Domain Foundation is a national NGO working in the health sector and as well as social sector to provide medical service for those people who are really who are affected by disease, especially tuberculosis, disability, mental health.
You have closely monitored the health sector for more than 2 decades. What is your assessment on Timor-Leste's development in this sector?
We have observed and experienced that in the area of health sectors and social service is still facing a lot of difficulties, challenges in terms of providing good quality health service to our community, especially for those who are really poor, disability and chronic patients in Timor-Leste. Because our mission is relief for those who are sick and disability without discrimination. So we know that Timor-Leste has a lot of priorities to address. But in terms of health service, social service to the most vulnerable people, still very lacking.
Timor-Leste has one of the highest tuberculosis or TB burdens in the South Asian region, with an estimated 6,000 cases annually. What are the main factors driving tuberculosis in the country?
You know, tuberculosis is what I can say disease of poverty. We have to allocate enough resources to fight against tuberculosis in Timor-Leste, because you probably know that currently for the last many years, I mean more than 15 years, the only funding available to fight against tuberculosis is from Global Fund. Mostly around 80% of the total funding through Ministry of Health is provided by the Global Fund. So that's why we advocate to government that if we really need to reduce the tuberculosis cases in Timor-Leste, we have to invest so that we can end TB by 2030 based on the Sustainable Development Goal that set by the Ministry of Health government.
So, Director, what are the challenges your organization faces in stopping the spread of TB and increasing treatment success rates?
Currently, we don't have enough funding, and that's a big challenge. In the last 3 years, when the government of Korea, through COICA in Timor-Leste, they provide extra funding to Timor-Leste through UN agency and Ministry of Health to do more case detection. And that was very successful because there was enough funding from other bilateral donors to support Ministry of Health to do. And that was the time in the Timor-Leste history, Ministry of Health could detect more than 6,000 new TB cases because of the investment from the COICA. So we are very grateful, and of course the bilateral donors in Timor-Leste that supporting TB program, because that is really important, because tuberculosis is the killer disease that affects and kills so many people every year.
Thank you for talking with RTTL News Director.
Thank you. You are welcome.